Hello, everyone. So first, I want to start by saying congratulations on your new venture to becoming an integrative healthcare system and utilizing the medical family therapy framework to achieve this goal. Well, in the US, integrative care is a new approach to addressing some age-old problems with the medical healthcare system. The medical family therapy is a practice that has been spearheading this shift to more comprehensive care, and it has also been around and developing since the 80s. Many mental health professionals or medical family therapists, or MedFTs as I might call them, were doing the work prior to the field name being coined. There was this recognition that health issues were impacting families and relationships and vice versa. The research shows that psychological issues can manifest biologically, and that biological issues can have psychological and social implications. Thus, the creation of the BPS, or the biopsychosocial model, by Greg Engel. And this happened, by George Engel in 1977. Later, spirituality was added to the BPS with efforts to be an additional support around meaning making for these patients. Many patients with chronic illness often sought after the medical professionals for spiritual support at a substantial rate. So in 2006, the Institution of Medicine highlighted the importance of incorporating spirituality into the BPS, now referring to it as the biopsychosocial spiritual model. So, medical family therapy and integrative care is all about collaboration. And that's the mind to the body, that's the individual and the family, that's the family into the primary care system. And also, what we'll talk about in a few, the clinical, financial, and operational worlds working very closely together. So, it's all about acknowledging that we are multifaceted, interconnected, and complex beings, and our health should be acknowledged and treated as such. Now, to implement this model into the healthcare setting, we should start by discussing the four-world view. And the four worlds are clinical, operational, financial, and training domains, which are all vital components of any healthcare system. So, implementing the integrative care and medical family therapy requires navigating this clinical, operational, financial, and training worlds in a collaborative way. So, each world has its own unique perspectives, goals, and challenges. And the level in which you desire to have an integrative system will affect how these worlds interact. So, for example, level 6 integrative care, which you have the infrastructure to achieve, consists of primary care clinic, in which doctors, nurses, administration, and staff all are under one roof or are under one umbrella tightly knit. That has a platform that should be accessible and easy for patients to use. Also, in level 6, it's marked by the inspiration of others towards integrative care, and that includes interagency consortium, collaboration, and the community, collaboration with the community, and opportunities for research. So now let's start going through each of these worlds. So for the clinical world, patient care and clinical outcomes and the quality of the care you provide is important. The goal is to improve patient satisfaction and utilization of your program. By you incorporating family systems theory and relational interventions, you can enhance your clinical practice. So the medical family therapist in this world looks like a person who's exploring the concerns of the patients. They're ensuring that the patients are well informed about the procedures, and they're verifying that they understand the next steps. The medical family therapist will also connect the patient or the family to other resources. So overall, in the clinical world, the medical family therapist addresses not only the physical aspects of the illness, but also the emotional, relational, and systemic factors that impact the patient's well-being. So next is the operational world. This world is about efficiency and workflow. It's the how-to. The idea is for you to look at what it will physically take and who it will take for you to provide the services that you have to your clients. This is about appointment making, to documentation, to connecting with specialists. How can the production of services be seamless? This also involves looking at the protocols within the collaboration between medical family therapists and the healthcare providers. So next is the training world. In this world, you look at what education and professional development resources you'll need for the healthcare providers. And what's important is the crux of implementation is that all your treatment team members understand the approach that you're using with integrative care and that we're working collaboratively. The more buy-in you have, the better the worlds work together in the implementation phase. So with that being said, as far as training, you can provide in-service trainings, which are over an overview of each employee's job responsibilities, how they can be reached, and important protocols for other professionals to know about that they have to abide by, for things with release of information and confidentiality, and how they may conflict depending on what professionals are interacting and how and what they need. Another part of training could be like mediation training. We all know it can be really hard bringing together entities to work together that typically do their own thing or have their own languages. So some training on problem solving conflicts and how to work together across different professional identities within your team could be helpful. So next, and finally, we have the financial world. Now, in the financial world, it's concerned with the value and cost effectiveness of the world, all the worlds, and not just the medical care. Medical family therapists are valuable in this respect by improving patient outcomes, reducing readmission to hospital, and enhancing overall healthcare efficiency. So the work of the medical family therapist typically begins in the screening phase. Now, you're going to have an appropriate screening protocol. And an appropriate screening protocol can be the difference between a family getting resources and them being lost in the shuffle. So screening involves identifying patients who may benefit from the medical family therapist. And these are tools that can range from general conversations with the family where you identify that they have some treatment concerns that may conflict with their spiritual practices. Or it can be standardized questionnaires or interviews to assess family dynamics and psychological stressors. You can also use evidence-based screening tools like CRAFT or DAST, which are for substance use screeners, and the PHQ-9 and the GAD-7. PHQ-9 is for the screening for depression, and the GAD-7 is screening for anxiety. Now, why these are important is because the symptoms that may show up for a patient or a family who is complaining of being anxious or depressed, these can also be the same symptoms that are concerning biological problems or medical health problems. And these screenings being done in-house is a direct act against or direct act towards dismantling any barriers that can inhibit patients from receiving their resources. So once there's a positive screening, and a positive screening means that we find that the individual or the family can benefit from the care of the medical family therapist or of collaborative measures. So once that happens, there should be a workflow that is clear and comprehensible, that shows steps to getting the patient to the integrative care that they need. So the first step for this workflow would be a referral to the medical family therapist practitioner, then an assessment, which is involving family interviews or that biopsychosocial spiritual evaluation we talked about earlier, to assess the needs of the family. The third step would be planning the intervention, which involves a collaboration of a team to come together to develop a plan. And for this team, the patients should be involved, the family members should be involved, and all the healthcare professionals who will be involved in the treatment should be on this team. An important characteristic for this treatment planning phase should be a humble, client-centered interaction with clear communication about next steps. And so then you have the implementation plan when whatever you planned, sorry, the implementation phase where whatever you planned is carried out. And then you have follow-ups. That's regular follow-up appointments to monitor the progress of the plan and see if there's any adjustments that are needed for the family regarding what was done or set in place. And some of the behavioral health interventions that the medical family therapist can use include family therapy, couples therapy. They can create genograms which are like depictions of family trees that show illness in their family history, and also the patient's illness story to understand how that illness has affected them on a larger scale. They can use a myriad of models in family therapy, like emotionally focused therapy, solution focused therapy, or narrative therapy. They can also use psychoeducation, which is providing information about medical conditions and coping strategies. And lastly, support groups, finding other people around who've had similar experiences that they can connect to and get support and grow their support system. Each intervention should be adapted depending on the social location, cultural norms, socioeconomic status, and individual family values and beliefs. The best way to know how to adapt to each family is to get to know the family and listen to the questions they're asking and listen to the answers they're giving during the screening or assessment phase. It's really important to be collaborative, treating this relationship like a collegial relationship where it's reciprocal. We're having conversations and we're bouncing ideas back and forth and listening to their different perspectives about how to address care. Now, this can take place on an individual or familial level. The treatment plan on an individual level looks at the individual's life and how the biopsychosocial and spiritual factors affect their health and takes account for these factors in the treatment plan. This supports using a systemic conceptualization of treatment. So we focus on the patient's specific needs, incorporating the medical family therapy principles to address how the family dynamics influence their health, even though their family may not be involved. When it comes to the family treatment plan, this involves the entire family in therapy, addressing relational issues, and it works towards creating a supportive environment for the patient's health. So to conclude, this integrative care system gravely supports better health outcomes for us on individual levels and it has national implications due to creating a more efficient and effective healthcare system. Thank you, and I wish you all the best on your endeavor to becoming an integrated care model utilizing medical family therapy.